Hello, and welcome to part two of the presentation looking at the intersection between homelessness and child protection, an integrated administrative data approach. My name is Alyssa Palmer, and I am a PhD candidate in the Institute of Child Development at the University of Minnesota. I will be presenting information from study 2, which is primarily focused on children's experiences of emergency or transitional housing use and child welfare involvement in the Twin Cities Metro. Much like work discussed previously, the experience of child maltreatment, neglect, and even just indicators of child protective service involvement has been related to maladjustment at school. Data from the Michigan Department of Education and the Departments of Health and Human Services reported that children who have been investigated for maltreatment have poorer math and reading scores in the 3rd grade. Further, a previous study conducted through MinLink showed that school-aged children in Minnesota showed decreased school attendance rates if they had been involved with a child maltreatment case. Experiences of homelessness and child welfare involvement have been connected. According to the Administration for Children and Families, roughly 10% of children entering foster care in 2015 were removed at least in part due to inadequate housing. Further, intervention studies have suggested that providing families with housing-related services reduces repeat maltreatment and facilitates reunification for families with children in foster care. This was true even for families that housing was not the reason for child welfare involvement. Some work has begun to address the issues of timing of when homelessness occurs in relation to child protection. Work by Faust and colleagues in a sample of children in Los Angeles, California, suggested that CPS involvement in 84% of cases preceded experiences of homelessness. However, other work has suggested that children referred to CPS, of those children, 1/3 were facing imminent housing problems. Further, some work by Cowell and colleagues evaluated timing, found that for kids using shelter or emergency shelters, 1/5 of the child protective service referrals occurred before shelter entry, 2/5 during the shelter stay, and 2/5 after shelter exit. Understanding the type and timing of service utilization will best help policymakers understand how to best introduce monetary support and training to help children and families most at risk. For providers, these findings could help support the inclusion of direct support programs for families and children. With this idea in mind, the Corporation for Supportive Housing and the Minnesota Department of Human Services presented at 8 regional communities of practice meetings to over 100 child welfare and housing professionals on the importance of housing stability for child welfare involved families. Their findings suggested that child welfare generally lacked awareness of housing resources that families can access. This included how to interact with the local coordinated entry system. Housing and homeless systems generally lack awareness of the child welfare system and child protective protection services. This included what services are provided by the child welfare system and what mandates the system must operate under, how families enter the local child welfare system, and the ways that housing systems can align with and leverage child welfare and child protection services. This qualitative study and outreach effort further reified the need for education and cross-system collaboration and training throughout Minnesota. With this empirical information in mind, study 2 of the training module aimed to evaluate the following 4 aims. Aim 1, is there an increased risk for child protective service involvement among children who have also used emergency/transitional housing? Aim 2, are experiences of emergency/transitional housing and child protective service related to proportional decreases in child attendance and increased school mobility? Aim 3, does child protective service involvement occur most frequently concurrently with experiences of emergency/transitional housing? Aim 4, are there different rates of child protective service track assignment and maltreatment determinations among families experiencing emergency/transitional housing? Through MinLink, or Minnesota Linking Information for Kids, we were able to integrate data across 3 systems. Child Protective Service data, the Homeless Management Information System, and the Minnesota Department of Education. Unlike the previous study, study 2 will be using a different definition of what it means to be homeless. We're going to be using the U.S. Department of Housing and Urban Development definition of homelessness. Namely, we will be focusing on children who are using shelters or transitional housing. Families who use emergency or transitional housing have additional contact with systems of support and are also often the most at risk for adverse effects. This is in comparison to families in permanent supportive housing or living with other families or friends. Indicators of child protective service in this study come from the Department of Human Services. All cases will be accepted cases, which means a report was made and a case was opened in child protection. We will further evaluate if cases were placed on the family assessment track or investigation track. If cases are investigated, we will then evaluate if maltreatment was determined or not. So this is our population. To meet inclusion criteria for this study, all children must have been a part of the Minnesota public school record system during the 13-14 or 14-15 school year. All children had to be school aged at the start of the study and under 18 by the end of the study period. The sample group included children who stayed in emergency or transitional housing in Minneapolis or St. Paul between August 1st, 2013 to July 31st, 2015. These dates were chosen in order to align with the school year's data. We then completed a propensity score match for this group of children from the general population of children in Minnesota. Propensity score matches allow us to control for all potentially confounding variables that may be related to child protective service involvement, besides experiences of emergency or transitional housing in the study timeframe. The matched group had to be in the same school during the same school year as a participant in the emergency and transitional housing group. We also matched participants on age, sex, disability status, race, free and reduced lunch status, the homeless and highly mobile indicator in MARS, and by CPS and homelessness, so emergency or transitional housing use, before the start of the study. This match process was successful, except that those who experienced emergency or transitional housing during the study timeframe were more likely to also experience it before the start of the study. This was controlled for in all subsequent analyses. Here are the general participant demographics. Children in the total sample tended to be younger or older on average, with fewer children in late childhood. Children of color were disproportionately represented in this sample, with the majority of children in the sample being children of color. This is vastly different from the general population where we drew the sample from, where, for example, Black children represent 12% of Minneapolis and St. Paul children, where you can see here they're making up 73% of the combined emergency/transitional housing and control group. The vast majority of children who used emergency and transitional housing did so only once in the study timeframe. However, a non-trivial amount of children used these services 2, 3, and even 4 times across the 2-year study timeframe. Of children included in this study across the control and HMIS group, 963, or 16%, used emergency and transitional housing before the start of the study. The vast majority of the HMIS group was also marked as homeless and highly mobile in the MARS data. However, there were 889 children that were not. In the control group, 1,709 children were marked as homeless and highly mobile, suggesting that all students included in the study are high risk. Subsequent results speak to the specific effect of emergency and transitional housing use on confirmed risk for child protective service involvement above and beyond the effects of the broader definition of homelessness and high mobility that are often captured by the HHM flag in the education data. 26.22% of students who used emergency or transitional housing also experienced child protective service involvement. 17% of children in the control group experienced child protective service involvement. The vast majority of CPS cases were placed on the family service track. Of those investigated, 356 were determined to be instances of maltreatment. Further, the vast majority of children experienced Child Protective Services once, with 254 children experiencing it twice. Aim 1 of the study was interested in what the general likelihood of Child Protective Service involvement was for children who were involved in emergency and transitional housing services across the 2-year time frame. We were first interested in studying this without accounting for timing or order of these events, just if they happened at all in the study timeframe. So children were 1.59 times more likely to experience Child Protective Service involvement when they had stayed in an emergency or transitional housing unit in the entire study timeframe. Now that we know that experiences of both risk factors are related to each other, AIM-2 wanted to replicate previous findings that instances of either of these are related to decreased school attendance and increased school mobility. Results suggested that children who experience homelessness attended 3% fewer days of school on average. Children who were only involved with Child Protective Service involvement attended 5% fewer days of school on average, and children who experienced both Child Protective Service involvement and emergency or transitional housing attended 6% fewer days of school on average, suggesting that there is a combined elevated risk. Children who experienced both homelessness and CPS were also 1.5 times more likely to move schools in a year, and children who experienced just HMIS or just Child Protective Services were 1.3 times more likely to move schools in a year. HMIS risk did not differ significantly from CPS only risk on that school mobility outcome. AIM-3 now starts to evaluate the timing or temporal effects and ordering of engagement with these services. Descriptive analyses suggested that on average, experiences of emergency or transitional housing and CPS involvement occurred within a 2-month period. When looking at all experiences of HMIS and all CPS experiences, the average distance of HMIS to CPS was 10.86 days with a mode of 1 day, suggesting that children often entered emergency or transitional housing first, and then about 11 days later entered CPS systems. When evaluating only from the first HMIS experience, the direction became even more pronounced, with the mean number of days being 46.15 days and the mode actually being 0 days. And that would mean that individuals most often entered HMIS, so emergency or transitional housing, and were referred to Child Protective Services on that exact same day. Using a series of generalized estimating equations, I tested the direction of entry into emergency and transitional housing and CPS case referrals. Children were 1.9 times more likely to be referred to CPS within the same month of experiencing emergency or transitional housing. Children were also 1.6 times more likely to experience CPS in the month after exiting emergency and transitional housing units. Interestingly, children were 0.3 times less likely to experience an emergency or transitional housing experience in the month after a Child Protective Service case. As time increased, children were 1.01 times more likely to experience Child Protective Services controlling for HMIS involvement. Older children at the start of the study were 0.2 times less likely to experience Child Protective Service involvement, meaning that younger children were more likely to be involved in these systems. Now, AIM-4 was interested if the type of CPS involvement mattered, but HMIS involvement at the same time as CPS, 1 month before and 1 month after CPS, were not related to track assignment, so that family assessment versus family services track. And then it also was not related to maltreatment determinations. So in conclusion, study 2 suggested that the combined effects of emergency and transitional housing use and Child Protective Service involvement increased risk for school mobility and attendance difficulties. Further, experiences of emergency and transitional housing use increased the likelihood of Child Protective Service involvement. HMIS most often occurred in the same month as CPS, and CPS were more likely the month after exiting emergency or transitional housing. CPS involvement decreased the likelihood of HMIS involvement the month after. And order to more causally evaluate the relationship between housing instability and child protective service involvement, in the future, we are aiming to evaluate if providing housing assistance through a local program, the Homework Starts with Home program, will decrease the probability of child protective service involvement, pending that program increased family stability. All right, so now we're going to discuss some broader conclusions and practice recommendations from our two presentations. First, we would like to highlight how central and important cross-system collaboration and administrative data were in answering these questions. Excuse me. Administrative data integration is something that is growing across the United States and has the power to inform policies and procedures to improve functioning for children. It is also important to note that analyses with these data are only good if they are clean and accurate data. This often depends on people on the ground who are also overworked and wondering why they have to report this data, doing a solid job of entering in the data. We hope that presentations like these, as well as the research briefs that you can find on the webpage for the Homework Starts at Home project, will show you that information and data can really push for policy change. And that is one of the reasons why we are asking you to do that. Both studies highlighted the importance of stabilizing housing for children and families. There's a lot of work happening in this area in Minnesota. Two concerted efforts are the Stable Homes and Stable Schools project, and the other is the Homework Starts with Home project. To learn more about these projects and the resources available through these projects, please see the links attached. As a service provider, there are also many steps you and your organization can make to assist families with this knowledge. Step one includes being aware of what families are at high risk for when they're involved with child protective services or housing instability. We also suggest that upon entry into both of these systems, workers screen for these risks at the onset of entry. These are critical pieces to understand and include in your case conceptualization. It is also important to both assist with a coordinated entry system and also explore resources and individuals to search for affordable housing. Some counties have created resources to assist with cross-sector collaborations. Encouraging the development of these systems in your county and being aware of what is already available will be really important. It is also important to be aware of and advocate for monetary resources for housing for families. A few potential options are listed here. Finally, we suggest that service providers think and plan for accurate and robust data collection, sharing in order for policy and scientists to continue to identify and follow these issues. And then here is a list of additional resources for further education on homelessness and resources specifically in Minnesota. Thank you so much for your attention. Yeah, and of course, if you have any questions, I believe both of our contact information is on the webpage.